Let's go through why it's better to be active during labour and cover some active birth positions you can use during your labour. Firstly, lying on your back is not the best way to birth your baby. Instead, being active during labour offers so many benefits that can help you have a more positive and smoother labour and birth. So let's go through some of the advantages of moving around during your labour and being active. Firstly, being active is going to help your labour progress. Staying active and changing positions during your labour can help your baby descend through your birth canal more effectively, potentially speeding up the labour process. Movement can also make your labour more comfortable, and this is because movement and position changes can reduce pressure on specific areas of your body and reduce discomfort and pain during your contractions. During labour, your baby's head moves through your birth canal, putting pressure on different areas of your pelvis and lower back. Staying in one position for an extended period of time can lead to increased pressure on these areas, which may cause you discomfort or pain. But by changing positions such as standing, squatting, kneeling, or rocking on a birthing ball, the pressure on specific areas is redistributed. For example, if you've been sitting or lying down for some time, getting up and walking around can help shift your baby's position and relieve pressure on your lower back and pelvis. The next reason is that movement and positions can help to open up your pelvis. Positions like squatting or kneeling can open your pelvis wider, providing more space for your baby to move through the birth canal. This can help the progress of your labour and make it easier for your baby to descend to be born. Certain positions can also encourage your baby to rotate and get into an optimal position for birth. Movement can help rotate your baby's head or body and can lessen pressure on areas of your pelvis and help your baby move more smoothly through your birth canal. Movement encourages blood circulation, which improves oxygen supply to your uterine muscles and surrounding tissues. Improved blood flow can lead to more efficient contractions and less discomfort during your labour. Movement can also help to relax tense muscles during labour, reducing muscle fatigue and discomfort. Different positions may feel more comfortable for you at different stages of labour, but being able to move freely and get into different positions, standing, kneeling, on all fours, or using birth props like birth or peanut balls will help you to find positions that suit your comfort level and provide relief from any discomfort you may be experiencing. Being active during labour can encourage your baby to get into an ideal position for birth, potentially reducing the likelihood of complications, and movement enhances blood flow, which is going to improve the oxygen supply to both you and your baby, which can lead again to more efficient contractions. Active labour is also associated with a decreased likelihood of needing medical interventions such as epidurals or labour augmentation during labour to speed your labour up or keep it going. Remaining active also allows you to be engaged in your labour, and it's going to give you a sense of empowerment and control, and being active can be a positive distraction away from the labour pain, helping you focus on movement and position changes rather than on the intensity of your contractions. Movement and changing positions can help you to relax and also to relieve tension. And this is going to allow your body to work more efficiently during labour, and movement may also help your baby transition through your birth canal and experience a smoother entry into the world. Now, it's important that the level of activity during your labour aligns with your comfort and physical capabilities. Every woman's labour is unique, and it's important to listen to your body and communicate with your healthcare provider or your birth support team to decide the most suitable activities, positions, and birth props that you can use during your labour. Let's finish off with covering some different positions you could use during your labour. When you're in labour, you have the flexibility to try different positions to reduce discomfort, improve the progress of your labour, and find out what feels most comfortable for you. The first positions you can use are upright positions. Standing and swaying or rocking your hips can help your baby move down and encourage progress. Walking during your labour can help with gravity. This can encourage your baby to descend, as well as helping cervical dilation. Next are your sitting positions. Sitting on a birthing ball and gently bouncing, swaying, or moving your hips around and backwards and forwards can relieve pressure on your lower back and pelvis. Reclining or semi-reclining, which is a more upright seated position, can facilitate better contractions and ease your breathing. And forward-leaning positions are another option. So bending over a bed, a counter, or a birthing ball allows you to take advantage of gravity and ease discomfort. Using a hands and knees position on all fours on hands and knees can help relieve back pain and pressure, as well as provide more room for your baby to move. Next is squatting. So this position is going to widen your pelvic outlet and encourages your baby's descent. It can be done with support or by using a birthing bar, which is attached to the hospital bed. And finally, there are side lying positions. So lying on your side is particularly useful for resting between contractions and can help facilitate optimal blood flow. Now, each labour position has different advantages, and it's important for you to feel comfortable and supported in your chosen position. Movement during labour is encouraged rather than lying on your back, as it helps your baby navigate the birth canal and may also reduce the duration of your labour. So it's important that you communicate with your healthcare provider or birth team throughout the process, as they can provide guidance and optimal positions based on your baby's position, the stage of labour that you're in, and your comfort. Remember, the goal is to create a supportive and empowering environment for you, allowing you to make choices that best suit your needs and preferences as you birth your baby.